Dr. Cheema is an accomplished internist. She completed her internal medicine residency from the University of South Florida, and she is a mentor to students and a published author in clinical research. Dr. Cheema participates in community services and believes in health for all. She is also running a clinic for low-resourced patients.
Hello, everyone. I'm going to share my life story and internal medicine path, why I do what I do. So I grew up in Twin Cities, Rawalpindi, Islamabad in Pakistan. So if you fly in, this is what it looks like. It's an aerial view. It's very crowded now, but it was a fun life there. And I spent a lot of time enjoying the northern areas close to these twin cities, the breathtaking views of nature, hiking tracks, and outdoor activities like boating and hiking were my hobbies. I went to undergrad in FG Postgraduate College, where I completed my undergrad. Then I attended Rawalpindi Medical University in Rawalpindi. Over there, it's a 5-year program. And after graduation, I did my house job at Holy Family Hospital and Rawalpindi General Hospital. It's equivalent to an internship here. And I did a house job in internal medicine and pediatrics. I moved to North America and I started studying for USMLE. And besides studying for that, I started doing clinical rotations to learn the health system and to polish my skills. And beside that, I started doing clinical research and contributing in the field of research, and I'm still doing my clinical research projects. I completed my residency in internal medicine from University of South Florida. I had a great time of my life in Florida, along with my kids, who enjoyed Disney World over there every other weekend. And after completing my residency, I started practicing as an internist in both inpatient and outpatient care. I'm a mother of 3 kids, and my youngest one is doing her part of awareness during this pandemic, and I would like to share her video with you for fun. Let's see if we can play that.
Hi everyone, I'm 5 years old. Welcome to Luna's Healthcare. I need to tell you the different infections, viral infections and bacterial infections. Today we're going to talk about coronavirus. Coronavirus is a viral infection. It is very contagious. We are in October 2020 and coronavirus cases are rising. But to remind ourselves to continue precautions, like washing our hands for 30 seconds, keep social distance. Most importantly, we have to keep our mask on. I hope you can continue precautions. Please remind others as well. Stay safe and healthy. See you next time. Hi everyone, my name is
I hope you enjoyed it. So let's take a real ride of internal medicine now. So what do you think when you hear internal medicine?
Thank you, Dr. Cheema. I just placed a link in the chat, which will take you to a website that you can enter your answer in, and or you can text the number 37607, and you can text that number TShadowing 823. Let me share the screen. And yes, you can follow the directions on the screen and you can enter your answer into the word cloud.
All right, let's see word cloud, how it looks like. So what do you understand by internal medicine? Okay, primary care, let's see. All right, so I think we have good. So I understand we have students from high school level to graduate level and international medical graduates as well who have already taken the USML exams. So I will try to have everyone learn from this shadowing session, and I will try to explain a few medical terminologies as well. First of all, we already discussed what is internal medicine. We had the word cloud. Okay, so internal medicine field dealing with diagnosis, treatment, and prevention of diseases and compassionate care of adults. So physicians specializing in internal medicine are called internists. And most fascinating part of internal medicine to me that I really enjoy is to diagnose and manage patients involving all the organ system and the broad spectrum of health issues. And are especially when we are specially trained and manage how to manage seriously sick patients, like we have rotations in ICU, it means intensive care unit, and CCU is called cardiac care unit. So typically internists perform physicals, they manage illnesses through medications, the non-invasive methods, lifestyle medical medicine. We do the lifestyle modifications counseling like diet and exercise. So when we do the internal medicine residency, it's a 3-year program, we have rotations, medical floor rotations, we have rotation in urgent care, we have ICU, CCU, emergency department, then we have a clinic once a week, this is called continuity of care for a patient that we see, and then we have electives in different specialties like cardiology, nephrology, and nephrology. So we have electives as well. So you might hear about the terminology inpatient care and outpatient care. What does it mean? So inpatient care means that patients are really sick and they need hospital care setting, and patients are admitted to the hospital. And when we say outpatient, it's a clinic visit, like for a wellness exam, like prevention, and these all the things we see in the outpatient care facilities. So I would like to go over briefly about the internal medicine cases before discussing in detail one by one, that what we see in inpatient care and what is outpatient care. So for cardiology, first of all, what is cardiology? It's a branch of medicine, manage the disorders of the heart. And most common cases that we see in the outpatient care settings, we manage hypertension, we manage the hyperlipidemia, and inpatient care needs when the patient is in a hospital setting, when they have a coronary artery disease. In other words, you can say heart attack, and say CHF is congestive heart failure, and then atrial fibrillation is irregular heartbeat. So I will go over pretty quick, and then we'll discuss one by one in our next sessions as well. And then pulmonology. So pulmonology is a branch of medicine, manages diseases of respiratory system. During this pandemic, there's a critical patients managed by pulmonologists who needs to be on the ventilator. So there are the pulmonologists who are working day and night, saving lives during this pandemic, unfortunate situation all over the world. And in outpatient cases, we manage asthma, chronic sinusitis, pharyngitis, rhinitis, bronchitis, and tonsillitis. These are the cases we see in the office setting, in outpatient care setting. For inpatient, like when patient has COPD, chronic obstructive pulmonary lung disease, and then the asthma has been flared up. So those patients need to be admitted in the hospital to manage. So we can say like outpatient cases, when they are not well managed and when patients are non-compliant with the medications, they end up in the hospital setting, then they need acute care to manage those cases, those disorders. So next we have is again a branch of medicine focused on digestive system and its disorders. Again, outpatient cases, we see the GERD, gastroesophageal reflux disease, dyspepsia, irritable bowel syndrome. And for the inpatient cases, when patients have the gastrointestinal bleed, it can be upper GI bleed, it can be lower GI bleed, pancreatitis, cholecystitis, colitis. And then we have infectious diseases. So for outpatient setting, we treat UTIs, skin infections, any eye infections, ear infections. And for inpatient care, when patient has a lung infections and any UTI that has been complex, that is worsened, like pyelonephritis, when infection has gone through the kidneys. And then cellulitis is the sometime we need patient to be admitted in the hospital. Next, we have endocrinology, is the study. I understand it's too much overwhelming for few of you, but when we will go over different case studies, you will enjoy this ride with me. Okay, so endocrinology is a branch of medicine dealing with the endocrine system. It's diseases specific for secretions known as hormones. So these are the conditions we treat as outpatient: obesity, overweight, diabetes we manage, hypothyroidism, vitamin D deficiency, and PCOS. And for inpatient care, when patients have diabetic ketoacidosis, so they need to be admitted in the hospital. And then when patient has poorly controlled blood sugar level, then we manage in the hospital setting. Next, we have nephrology. So nephrology is dealing with disorders of kidney functions. And for inpatient, outpatient, both, we can see acute renal failure when their kidneys are not functioning appropriately. And then hyponatremia, hyperkalemia, and diabetic nephropathy. So again, for hematology, it's blood disorders we manage, like anemia, thrombocytopenia, leukemia. Then we have neurology. It's a branch of medicine with disorders of nervous system. And we see outpatient management. We can see headaches, migraine headaches, any dementia, and patient, for inpatient care, we have to manage stroke. And we will talk about, well, we'll discuss one case today, and then transient ischemic attacks. And then general medicine. It comes for outpatient care, like patient comes in with fatigue, malaise, an anxiety disorder, depressive disorder, and any OBGYN cases, and STDs in both male and females. And for inpatient care, when patient has a fall and with injuries, so they need to be admitted in the hospital, any metabolic encephalopathy, and any arthritis that is very painful, pain control management, or they need some surgeries, and then they need admission in the hospital. And for prevention, so internal medicine, the beauty of this, that we also work on the prevention, and also we do the lifestyle modification. We do a lot of counseling parts, a lot of patient education is very important in this. And this in the prevention part, we do immunization, we do the disease screening, and the counseling on smoking cessation, overweight, and then we do follow-up examinations, routine health and wellness exams, and pre-operative risk assessment we do. And for inpatient, again, falls, when patient admitted to the hospital, make sure for any other medical conditions, we have to make sure they are not their ability to walk appropriately. So we have to make sure to avoid any falls while in the hospital, any skill care conditions. Like if patient is lying in the bed for long, they can have some bed sores called decubitus wounds. We have to make sure we are taking care of skin care, and diet is very important. Is for different, like if patient has some renal issues, so patient will be on the renal diet. Patient has diabetes, so patient will be on the carbohydrate control diet. And if a patient is admitted for the cardiac issue, so patient will be on the cardiac diet. And for DVT prophylaxis means when patients are lying in the bed for long, they can develop any clot in the legs. So we start some medicine for that called blood thinner to help them to prevent the clots in the legs. And rheumatology is include the bones, muscles, tendons, and ligaments and soft tissues conditions that we manage. Again, outpatient setting, we see a lot of back pain, shoulder pain, arthritis, and fibromyalgia. And for inpatient care, we see bone fractures. They need to be managed by orthopedic surgery. But of course, sometimes there's some hospital settings, medicine team follows them and surgery team will be consulted. And so both teams go side by side, and any joint replacement. So outpatient care setting, when we see dermatology cases as well. So dermatitis, any atopic dermatitis, acne vulgaris, and skin and soft tissue infections, bites, and infestations. And we also see some ENT cases as well in outpatient setting, like otitis externa means infection of the outer part of the ear. Otitis media means infection of the inner ear, and then sinusitis, rhinitis. And for the ophthalmology, we just see the conjunctivitis, stye, dry eye, blepharitis that we can manage in the office setting. All right, so let's take a ride and see one patient in the hospital setting. So everyone, since you guys are shadowing me, whiteboard on, stethoscope ready, right? Okay, all right. So let's go to the medical floor. I will talk a little bit about outside the patient room. I'm going to talk a little bit brief history, and you will tell me what do you think about what's going on with the patient. All right, so here's the patient. She's admitted. She presented with she's a 67-year-old female. She came to the emergency department, brought in by the family with altered dental status, means she was confused. She was not at her baseline, and she had a slurred speech. So while she was watching TV early this morning, so what do you think? Just with the history, so just a brief history. We take a detailed history, but I'm just giving you history. Let's see in the chat what responses we get.
And can you repeat the question?
Okay, we said stroke, stroke. Everyone is saying stroke. Okay. Okay. All right. So now let's see. I'm going to give you more detail about it now. Physical exam. Let's go back. Okay. So here's the physical exam. So on examination, again, we do a detailed examination from head to toe. I'm just telling you the vitals first. So blood pressure is 180 over 105. I make it red. This means it's high. So normally we say is 120 over 80. Pulse is 82, respiration 16. Pulse ox is 98%. Temperature is 98 Fahrenheit. And then we do, I mentioned from head to toe examination, I'm just giving you a neurologic examination. That patient was awake but confused. Patient had a slurred speech, and there's a right upper extremity and lower extremity weakness. So when we question the patient seems to be very understand what you're talking about, but he's unable to clearly respond. So now I'm going to go next, differential diagnosis. What do you think going on with the patient? So I gave you brief history, I gave you brief examination. So just you guys let me know what is a differential diagnosis. So let's open the word. Which differential diagnosis you can think of.
Okay, just like last time, everyone, we're going to be opening the link in the chat, and the word cloud will be made automatically.
All right, good. So we got a lot of differential: stroke, hemorrhagic stroke. Okay. All right, good. Right. So differential diagnosis, it means that when a patient comes in with a symptom, we have a more than one possibility of that patient's diagnosis. In the two or more conditions when patient present with any symptoms to determine the actual diagnosis. And it involves several diagnostic tests to rule out different possible disorders. All right, so I need to share my screen again. Here we go. Okay, so which diagnostic tests we do? First of all, CBC is called complete blood count, where we see different parts of the bloods, like mainly white blood cell count, red blood cell count, and platelets. CMP is a comprehensive metabolic panel in which we see the kidney functions and the liver functions. And urine analysis, we check for any infection, that because patient is confused, we're thinking of, okay, maybe it can be delirium. So underlying infection can cause patient to be confused. And sometimes in elderly people, patients who have a UTI are more confused. So then we check urine analysis to make sure there's no underlying infection going on. Then we check the lipid panel. So we can assess cholesterol level from this. And in this case, patient has some issue going on in the brain, right? It's which part of the system is neurology. So what we do, CT scan of the brain is more diagnostic. So normally in the USMLE exams, they ask you what, when patient present like this, they give you history, they give you exam. So they ask you what is the next best step. So what will you do? Of course, we do all diagnostic tests, but next best step to diagnose is a CT scan of the brain. That will tell us whether patient has any bleed going on in the brain or patient has any ischemia. So this is how we diagnose patient has. So you are right, many patients had stroke. This is called cerebrovascular accident. I know it's a new terminology for a few of you, and it will be overwhelming, but bear with me. And then we'll keep doing cases more in next sessions. You will be more familiar, and it will be a piece of cake for you at some point. All right, so in this case, we're saying it's a hemorrhagic stroke. Why? Because blood pressure was high, right? So I will show you images on the CT scan, how it looks like on the CT scan with hemorrhagic stroke. And what are the risk factors? First of all, pretty quick, smoking, high cholesterol level, obese patients, diabetes, hypertension, atrial fibrillation means irregular heartbeat, age, and the male gender are the risk factors for stroke. So pretty quick anatomy of the brain. There are different lobes of the brain. Frontal lobe, this is the parietal lobe, this temporal lobe, and this is the occipital lobe. And this small portion is the cerebellum here. And this is the blood supply of the brain. So I will not go in detail, just pretty quick. Anterior cerebral artery, this green portion, supply the anterior cerebral artery, middle cerebral artery, and posterior cerebral artery. So these are the main three arteries supplying the lobes of the brain. And this is the medial view of the brain, because there are two lobes. So when we do like this, so you will see the medial view, and from the outside you can see the lateral view. And you can see this yellow portion is supplying the anterior cerebral artery. This blue, you can see posterior cerebral artery, and the lateral view is supplied mainly by the middle cerebral artery. All right, so I mentioned that for this case, we do a CT scan. So what is a CT scan? Basically, it's a imaging how to see different tell us about the detailed images of the body. We can get CT scan of any part of the body, but in this case, we will obtain CT brain. It will help us with the diagnosis. And CT brain, it provides the detailed information about brain tissue and the brain structures. So I just told you briefly about anatomy and the blood supply of the brain, and I will show you how it looks like. So this is a normal CT brain. And if you'll see this white portion, this is skull. Why it's white? So bone absorbs most of the X-rays to the, and this skull appears white on the image. And the water in the brain, these small cavities, the fluid-filled cavities, they absorb less X-rays and they have darkened areas, and they are called less dense areas. So this is a normal brain CT scan, and the blood in the hemorrhage is denser, and if you have a stroke, it will be less dense. The blood supply to the brain. The vessels that carries the blood to the brain, they cut off. It can be cut off because of any clot in there, or they can get rupture. So their blood supply has been cut off, and that's how we have some issue going on with the brain, and the brain is not functioning normally, and patient is confused, like in this scenario. I'm going to say, what is ischemia? So ischemia is an inadequate blood supply to any organ or any part of the body. So like any clot, if you have any clot in the brain blood vessels, you will have ischemia of the brain. If you have clot in the any blood vessel of the heart, you will have ischemia of the heart. So this is called ischemia. I know we have a high school student, so I'm trying to just explain briefly. And what is hemorrhage? Hemorrhage is a escape of the blood from the blood vessels, as it can happen to any blood vessel. And when it happens in brain, it causes bleeding in the brain, which reduces the oxygen delivery to the brain. So I'm going to show you pretty quick. This is normal CT scan of the brain. And next, we have the hemorrhage, this white area. So this is the middle cerebral artery portion that has we can say middle cerebral hemorrhage, middle cerebral artery hemorrhage happened here. That's why patient is confused. And when it happened on the left MCA, means left middle cerebral artery is affected. So patient has symptoms on the right side. So contralateral. So patient had the weakness of the right upper extremity and right lower extremity. So this is what's going on. The patient had a hemorrhage on the left side of the brain. And this is the hemorrhage you can see. And next image I can show you. Again, this is the normal. And you can see this area over here. So this is ischemia. This is darker in color as compared to the other section you can see. So this is a grayish area, but this is a little darker. So this is ischemia. Ischemia means it can be some clot in there in the blood vessel. So it's cutting down the blood supply of the brain. So I'm gonna do one quiz with you. Let's see. So is this a CT scan? Is the ischemic stroke or hemorrhagic stroke? All right, 100% saying hemorrhagic stroke. Okay, good. So you grab the point. So this whitish area is a hemorrhage. So hemorrhage means blood has been leaked out, some rupture happened there. So different arteries we discussed for the brain. And yes, it is a hemorrhagic stroke. So good. So you guys are paying attention. Great, awesome. All right, I'm gonna finish this here. Okay. All right, so this is the, I have to get rid of this now. Just keep coming on my screen. Okay, all right. So this is what we discuss about the cerebrovascular accident stroke patient. So in next sessions, we'll talk about one case or maybe couple of cases. And then I will ask you, you tell me differential diagnosis. This is how we get training in telemedicine. It's a group we talk about physical, in detail physical, then examination, then blood test, then imaging. So after diagnosis, what we diagnose that patient has a hemorrhagic stroke, right? So after that, we have to make a treatment plan. So we have to treat it. So finally we diagnose the patient has a stroke, and it's a hemorrhagic stroke. So I'm not going to go in detail. This is how we learn during residency. We have to treat each and every patient on an individual basis, based on their history, based on their physical. So this is how we need to manage each patient on an individual basis. So I will not go in detail at this point, and there will some point about treatment and plan as well. So this is all about today's case. And the next session, we'll discuss more systems, more cases, and you will get more familiar. And there is an online course available on Coursera. If you go there, you can learn medical terminologies over there, and they can provide you some certificate as well. It can help you with your clinical rotations if anyone interested in doing that. So I will go over pretty quick about medical missions we do. So this is a underserved area. We do the free medical camps there, and we see the patients. We provide free medications to them. It's just community services. And I will recommend, when all of you will be at some point, will try after achieving your goals, start paying back to the community. So this is one of the clinic in Pakistan, and we do via telemedicine as well. And we do some community projects in DC area as well. We have association of Pakistani physicians who are doing it in a DC, Maryland, Virginia area, where we do free medical clinics. And recently we did the COVID vaccination as well. And this is how we try our best to pay back the community. And I would like to share a very brief video with you, how just give a quick snapshot. I don't, there's no audio. Let's see. I cannot see any audio there. Okay. All right, so we don't have a, it's okay. All right, so this is a brief video. I want to share it with you. All right, so that's all about what I do, why I do. And I really enjoy my internal medicine because I see different cases, and it's a great reward when you help someone to get better and they feel good. All right, so next I would like to share. It's not going, okay. So what you can do. So you need to be proactive. Plan ahead. What do you mean by that? Like if you're undergrad students, so I will say start doing 1 MCAT questions a day. I know some people will laugh. You know, so I will say it will make a lot of difference. And for international medical graduates, while even they're in the medical school, if they want to pursue their career in the United States, so they should start doing the USML exams while they are in medical school. It will make a lot of difference. And also put first things first. I learned in my high school, one of my teacher taught me to get something, to sacrifice something. So I still remember everything, like, because she mentioned one of our class fellow didn't do her homework, and she was upset about it. So she said, oh, I was watching movie and this and that. So she said, okay, so you sacrifice your time, your study time for your fun time. So likewise, if you enjoy, we want to have fun time, we sacrifice our study time. And if we have study time, we're sacrificing our fun time. So it's up to you. Put first thing first. What is important to you? Then, of course, work hard. There is no magic in this world. It's practice, practice, and practice. So you will see there's no magic in the world. Please practice and do your clinical internships. You can start doing some medical assistant positions, start doing some clinical research assistant positions. Medical scribe jobs will help you. And as I mentioned about online courses, you can learn about clinical terminologies. And whatever you do for longer time period. Don't just do for a few months this and here, there. Longer is better than many. And also never give up. I can tell you from my experience, persistence is the key to success. So please be persistent, whatever you're doing. And of course, it's very frustrating. A lot of sacrifices, a lot of frustrations. Of course, there's a lot of anxiety, downtime. But again, I discussed in my previous sessions how you can keep up with your health, right? Your emotional health, your spiritual health, your intellectual health. So all these you have to take care of yourself first. And of course, it's you have to achieve your goals by doing one day at a time. All right, so this is all for today's session. I will wrap up over here, and thank you, everyone. I will wish you best of luck and best wishes in your career. Here's my email. Anyone want to contact me? I will try my best to answer as soon as possible. Now I will move on to any questions for me.
Thank you very much, Dr. Cheema. Really appreciate it. And now we'll begin our second Q&A session.
Thank you, Dr. Cheema. To start off our second Q&A, one question we had was, why did you choose to specialize in internal medicine?
Sorry, I couldn't hear you. Can you please repeat again?
The first question we had was, why did you choose to specialize in internal medicine?
Right. It's really fascinating. Your internal medicine, you see different cases, as I mentioned before. I can see from head to toe. All patients, I can see, I really enjoy seeing different, I don't get bored seeing one thing, only one system. So different, I can see different cases, like I discussed with your neurology case today. And next time I will discuss with the cardiology. So this is how, and also I do both outpatient and inpatient. First of all, it's really good for continuity of care. Like the patient I'm seeing in the outpatient, if they get admitted to the hospital, I follow up them in the hospital as well. So it's called continuity of care, because I know the patient very well, because I'm already following them in the office setting, and God forbid, and something acute happened that they need to be admitted in the hospital for any reason, I can follow up with them and they feel comfortable as well that their doctor is seeing them in the hospital. So that's why I really like it. And it's one of the best specialty, I would say, that I chose. Of course, everyone will say their reasons, but I love seeing different kinds of diseases and different systems I can see and manage and help them.
Thank you. Another question we had is, what is involved in internal medicine residency training and rotations?
Right. Yeah, so my internal medicine residency normally for everyone is 3 years. First is internship, and then we have 2 years of residency program where you are a senior resident, where basically you are the boss there, and you oversee the interns and you oversee the medical students over there, and you run all the group, and of course you run the cases with your attending physician. But before running the case, you have to go and see your patients in the morning time. So it was really, I would say, it's really a learning program, but of course stressful as well. But as I mentioned, you need to have your coping mechanism, how to deal with because when we were on call, like we were staying there till 12 midnight, and then we are back in the hospital 5 in the morning. So just 4 hours, 5 hours, right? So again, it was really rewarding. I really enjoyed my residency training. And while doing internal medicine, we do different procedures as well. And I did a central venous line, like I had my rotation in intensive care unit. So intensive care unit, we are the sickest patients. They need a more intensive care. So we have most rotations there in ICU as well, where we do different procedures like central venous line we can put on. If you are more passionate, you can put the trach in, like you can trach the patient. They can, it all depends on you, whatever you want to do. So it's all your learning, but I did a lot of procedures because I love doing the procedures. So it was really fun for me to learn, and it was a great learning for me.
Thank you. And for our last question, we've heard that you write book reviews. Do you have any book recommendations for us to keep us motivated during our healthcare journey?
Good. So definitely, yes, I would recommend 7 Habits of Highly Effective People. It's really good book. I write on proactiveness. I mentioned you proactive. First things first, I took those points I learned those points from that book. So please keep learning. And it's really good book. Whenever, it's not just one time. I keep reviewing over and over again. We all human beings will forget. We have a lot of things to do in our life. So definitely, I would say keep that book handy all the time with you whenever you feel like, okay, I need motivation, okay? And also, if I motivate you at some point, okay, it's just a couple of hour session, we're gonna turn off, okay, motivation is gone, right? No, so self-motivation. So please go towards the self-motivation. Like motivation doesn't last long, but we take bath every day, right? We eat every day, right? So likewise, we have to motivate ourselves every day. So this is called discipline. Like you have to do the stuff that you don't want to do. Like, okay, oh, I have exam tomorrow, my physiology, my mammalian physiology exam tomorrow, but I don't want to study. No, but you have to study, right? You have to discipline yourself. You have to cut off your fun time. So you're sacrificing. So that's what, when I talk about sacrifices, like you're sacrificing your fun time. But believe me, I can tell you, when you achieve your goals, you have a lot of time to have fun. So don't think, oh, this is a college time, we have to fun, we will miss that. No. So please focus on your goals, whatever you want to be. And then you will definitely have a lot of time to fun in your life. And it's a great, rewarding great reward to be a physician or nurse practitioner or RN or DO or physician assistant. All medical healthcare, I would say, is really rewarding when you when patient tells you, "Oh, doctor, thank you," or nurses. So it's a teamwork. It's not only physicians, nurses, even house staff. They keep the hospitals and clinics clean for you. So it's a teamwork. So definitely, it's a great award. And please keep up whatever you want to do in your life and stay motivated. And this book is really good for you.
Thank you very much for your time, Dr. Cheema.
My prayer. Again, I will wish you good luck, everyone. And any questions, please feel free to email me, and I will try my best to reply. I know I will get a lot of emails that I'm getting before, but please bear with me. I will try my best to answer. Okay, all right. Thank you, everyone, again. And I would like to thank you, everyone, all the TeleShadowing team members, ambassadors, and keep up the great work.